The first category of drug we're going to be talking about is discussed on page 268, and these are 267 on the table, and then in the text it's talked about on page 268. And these are drugs called the platelet inhibitors. Now, in the normal action of the clotting cascade, we have small cells that are included with the red blood cells, and they are known as platelets, and they tend to stick together. And especially if there's an injury, they will get stickier and want to clump together to protect us from bleeding too much. And in the normal course of things, that's fine. When we fall and scrape our knee or we cut ourselves, we want platelets to stick together and stop that blood from oozing. But if you have a condition present in which you're at risk for forming a blood clot in the leg, or a blood clot that might travel somewhere else, that becomes not a thrombus but an embolus, we want platelets not to stick together the way they ordinarily would. So by taking medications to inhibit this platelet clumping or aggregation, we're going to reduce the risk of forming a clot. So these drugs are used in cases where you have some blocked blood vessels. If you are having some sort of a stent placed, or a venous or arterial graft to keep a blood vessel open, you want to prevent clots from forming in those, and you want to prevent strokes in somebody who is at high risk or has already had one. Now, the most common platelet inhibitor that we see is aspirin. Very simple medication, one that's been around for quite a few years, usually associated with pain and inflammation and fever, but it also does a really good job of inhibiting platelet aggregation. So aspirin can be given to reduce the chances of a repeat MI death. A big study was done some years back in men over 50. They did not test women, it was all in men. But it was found that men who had already had an MI, who were on regular doses of aspirin, tended not to have a repeat of that situation. They are the drug of choice in ischemic stroke, where clots form and prevent oxygenated blood from going to the brain. We know that aspirin have a lot of side effects. Petechiae, which are little ruptured capillaries all over. Looks like little spots or freckles. You tend to bruise more with aspirin. Your ears will tend to ring. And you can have some internal bleeding that can lead to black stools. You want to avoid taking aspirin with NSAIDs like ibuprofen, because you can run the risk of internal bleeding in the abdomen, a GI bleed. And there can be an aspirin allergy. And this portrayal shows natural side effects of aspirin, which tend to be nausea, stomach pain, heartburn, perhaps vomiting. And then the effects found in red are a little bit more serious. And so you always have to watch out for those. Aspirin can be a common drug that causes allergic reactions because of its natural origin. It was found in the bark of trees. Some other antiplatelet agents that are a little bit stronger and are used more in a clinical setting. We have the big three here: dipyridamole or Perzantin, ticlopidine or Ticlid, and then clopidogrel or Plavix. And these are often used after some kind of a clinical situation where a patient has had cardiac issues, they've had a stent placed. So by giving one of these drugs, you can prevent another MI, once again in men, where the big study was done. If a person has a situation in which they are at high risk for MI or stroke, They sometimes will give this along with other agents as a preventative. So when they use a thrombolytic that dissolves an existing clot, either before the stroke or MI can happen, or in the very early stages when before damage has been done, they will turn around after the thrombolytic is given to break up the clot, and they will give an antiplatelet agent to prevent another one from happening. And it's recommended that clopidogrel or Plavix is usually going to be taken for more than a year after cardiac stent placement. You've got that little wire stent in there that keeps that blood vessel open, and you don't want clots to form around that. And so Plavix will help prevent that but you need to take it for quite a while. On page 269 in the book, there is a safety alert when it comes to aspirin. Aspirin interacts with a lot of herbal drugs, as you can see in box 14.1. And not only aspirin, but other anticoagulants. Lots of drugs can interfere with that. And then any patient who is taking platelet clumping inhibitors or anticoagulants need to watch out for these signs and symptoms of bleeding. And one of the first signs of bleeding of internal bleeding, or the tendency to bleed internally, is oozing of blood from the gums. So if somebody is on warfarin or Plavix, or even a regular dose of aspirin, and they notice that when they brush their teeth, their gums are oozing, that can be a sign that maybe their clotting factors are being too inhibited and they could be at the risk for an internal bleed. So you want to always watch for increased bruising or petechiae that can indicate clotting problems.